Our main screen on which we have to work upon. The CT scan of the patient is already been fed into my system, and as you can see, all the cuts are there, all the planning is in front of us. How much cut I have to take from the posterior part of the femur. This is the virtual image of the implant which will go in. As you can see, whole of the implant, the virtual image. This is what our knee is, and how it has been placed and how it will be placed upon the patient is already in front of me, from front to behind. So what it does, it gives me an accuracy which is up to 0.5 of a millimeter. So that is a very high accuracy level. It will not let me deviate in any way. Whatever has been planned, it will be executed. What will help me out? This is the robotic arm. This is the arm which goes with me. This is the body. This arm, this camera communicates with the patient. When I will be putting on the arrays, we can see it. We will communicate with the patient, and as we go ahead, I will be explaining all the steps to him. Thank you. So, getting scrubbed, getting myself absolutely sterile is part of the surgery, and this is very important because although I will be wearing gloves and everything, the skin can be a bit unsterile, so we have to scrub it properly. And secondly, this is the time before the surgery when I am just revising all the steps, how I will go about it, what are the things that I have to take care of, because as a surgeon, for me it's an everyday affair, but for a patient it's once in a lifetime. So every time when I go in the surgery, I always keep in mind that he will be undergoing this procedure once in a lifetime. He has put faith in me, so I have to justify that faith. Similarly, before starting a surgery, I revise all the steps and I manifest a good surgery and a good outcome. These are the arrays which communicate with our robotic system. Same arrays will go into the bones also. So the bone, the robotic arm and the camera system, all three will be communicating with each other in sync to give us a good surgery. So when we operate, our blood field, our surgical field is absolutely bloodless because all the blood has been taken out of the limb. So now we are placing the arrays which will communicate with the camera and the robotic system. The femoral array is placed and the tibia array is placed, and now we are checking the position and the rotation so that at all times it communicates with our robotic system. Everything is being tightened because if they are loose and they are not in the place, our surgery cannot be executed. Now whole of the femur which is on the robotic system is being mapped again. We are mapping all the points on the femur. There are 40 points on the femur which are being mapped. One by one, whole of the CT scan system which has mapped my femur is being checked. In a way, now what I am doing, I am telling the robot where my bone is, so that when the saw comes, it knows where to cut. Whole of the femur is mapped. Similarly, Now the lower bone, that is the tibia, is being mapped. 40 points on tibia also. Our mapping is almost complete, and the robot now knows the exact anatomy of the bone, which has already been fed into it our day before by doing the CT scan of the patient. Now what is being done? Only the bony part was fed into the robot. Now we are giving robot the soft tissue component. In extension, we are opening up and we are closing the gaps on the knee so that robot exactly knows how much laxity or how much tightness is there, both in extension and now in flexion also. All this is fed into the bone, and now here is the exact position of our knee. How much lax is it on one side, how much tight is it on the other side, and now we can execute a surgery even before going for the final cuts by fine-tuning the components. Here what we are doing, both in extension and in flexion, we are fine-tuning and we are seeing where our component is exactly sitting. Once whole of the component is done, whole is being recorded, now our robot is being docked and it is being brought into the scene so that the robotic arm, which has got the saw, will help me taking the cuts. Now once again the robot is being told where the bone is. It has to be checked again and again. Now our robot is ready for the cuts. First of all, it is the femur that is being cut. As you can see, the robot is being held by me, and all the blue is the extra bone that has to be removed, which has already been taken into account. And you can see there is a green boundary. A green boundary is a safe boundary which will not allow my saw to go beyond it. So all the cuts have been taken, and finally again after the cuts I am rechecking whatever we have done, has it been perfect or not. So as you can see, after the cuts also everything has been rechecked, and now the camera and the robotic system has given me a go ahead that whatever we had planned, we have executed it. Whatever we have planned, we have executed it to the limits of 0.5 millimeters. So this is how technology works in harmony with the doctor.